Here is tip number 3 for adults exercising with scoliosis. Know your risk factors. By screening for risk factors, you will be better able to tailor your exercise program. While many adults with scoliosis never have pain or disability due to their scoliosis, some may be at risk for curve progression, pain, and disability in the future. This is based on research identifying risk factors called adult spine modifiers. Adult spine modifiers are radiological parameters that have been associated with poor health-related quality of life outcomes. This is based on a published consensus and research investigating adult patients who received fusion surgery due to their scoliosis. The radiological parameters that were most correlated with pain and disability were called modifiers and were shared by those who required surgery. They are considered predictors or risk factors and can be used to identify those adults with scoliosis who may want to consider some modifications of their fitness programs. But what if you are doing fine and don't have an X-ray? 3 clinical tests have been shown to correlate with 3 of the radiological modifiers that represent increased risk for pain and disability in the future. The first is the presence of a lumbar or thoracolumbar primary curve pattern identified using a scoliometer. The second is sagittal imbalance, which we discussed in tip number 2, measured using a plumb line or the wall. The third is coronal imbalance, and it's measured using a plumb line. These tests are provided by healthcare professionals and fitness professionals. These tests can identify risk factors and help you select exercises and a fitness program that is best for you. Sagittal imbalance often begins with loss of lumbar lordosis as a result of degenerative changes and lumbar instability. This results in forward flexion of the trunk and can be measured as the distance between C7 and the wall. A measure of 4 centimeters or more is associated with greater risk for pain and disability in the future. If you have sagittal imbalance, you need stability. We looked at exercises to help with sagittal imbalance in tip number 2. Measuring coronal imbalance tells us how much deviation there is between the thoracic spine and pelvis in the frontal plane. This is measured using a plumb line dropped through the center of the sacrum. If C7 is 3 centimeters or more from the plumb line, there is coronal imbalance. This can increase shear forces at the hypermobile transition points between curves and can be a risk factor for pain and disability in the future. These transition points need to be stabilized during exercise programs. The scoliometer measures the angle of trunk rotation and helps identify a structural curve versus spinal asymmetry. It helps us find the apex of each curve, and if the apex of the curve is at T12 or lower and the pelvis is shifted to the opposite side of this curve, then the curve pattern is a primary lumbar or thoracolumbar curve. These patterns are considered a risk factor because they tend to have transitional areas at L5-S1, where the curve changes directions, causing a pelvic shift. This is already a hypermobile area of the spine, and it can easily become now 3-dimensionally unstable if there are degenerative changes, especially in adult onset scoliosis. These curve patterns need stability not mobility. Exercises that emphasize mobility when you have these risk factors should be modified or avoided. Stay tuned for tip number 4. Thank you.